In this video, I'll be performing the skill Gives Modified Bed Bath, Face, One Arm, Hand, and Underarm. Before we get started, I just want to key you in on a couple of things. One, the critical element step is step number 6. You have to perform step number 6 and you have to perform it correctly. If not, you will not receive credit for that step and you will automatically fail the skill. That step involves the cleaning of the eyes. So you have to go from the inner canthus to the outer canthus. And you have to actually clean the eye. You cannot go above, below, or do it in the air, okay? The second thing that I want to give you information on are steps that are mostly missed in this skill. There is actually 3 steps. One is the removal of the gown. So to diminish your risk for not performing that step, you want to go ahead and remove the gown after you have the resident to test the water. Another step that is most often omitted is placing the barrier or towel underneath the arm. The third step that is mostly missed or omitted is the drying of the face. You have to dry the face and you have to dry it with a towel. If you dry the face with the washcloth, you will not receive credit for that step. So without further ado, let's go ahead and get started. Okay, so the supplies that you will need for this skill is going to be 1 bath basin, 1 gown, 1 towel, 3 washcloths, 1 to wash the face, 1 to wash the arm, hand, and underarm, and 1 to rinse the arm, hand, and underarm. You'll need soap and 1 pair of gloves. So you can go ahead and collect your supplies now, and once you get your supplies, we'll get started. Good morning, Miss Meredith. My name is Julie, and I'm going to be your CNA today. I'm going to go ahead and give you a bed bath this morning, okay? All right. Before I get started, I just want to go ahead and provide you with privacy. And I'm going to do a quick safety check, making sure that the brakes on your bed wheels are locked, bed is in the lowest position, and you have your call light right there, okay? I'm going to go wash my hands and gather my supplies, and I'll be right back, okay? Hi, Miss Meredith. I'm back, and I have all my supplies. And the first thing that you want to do is test the water. You can test with your wrist or your elbow. And then you'll want to have the resident to test the water. Miss Meredith, I've already tested the water. It feels okay to me, but I would like for you to test it to make sure it's a comfortable temperature for you. Okay, all right. Now, once that you've tested the water, remember I told you that one of the most forgettable steps is the removal of the gown. So at this time, you want to go ahead and remove the person's gown. I'm going to go ahead and put my gloves on. Miss Meredith, I'm going to go ahead and take your gown off, okay? I'm going to set your call light here on the table, and I'll give it back to you before I leave. Can you lean forward for me a little bit, please? Okay. Now, when removing the gown, you want to make sure that you do not overexpose the resident. So I'm going to cover the resident, and I'm going to remove the gown from her arm. And lift up for me there. Okay. And I'm going to roll the gown away from me so it will not touch my clothing. Okay. Once you remove the gown, you want to make sure that you immediately take it to the soil utility cart, okay? Okay, so the first thing that you want to do now is wash the face. Remember, the critical element step is step number 6. You have to start cleaning the face with the eyes first. So I'm going to wet my washcloth. I'm going to squeeze it out. And I'm going to show you a trick here. If you open up your washcloth and fold it into 4s, because you have to use a clean area of the washcloth with each stroke. If you use the open corners, you have 1, 2, 3, and 4 clean areas of the washcloth, okay? So I'm gonna go ahead and I'm gonna start with the eye furthest away from me. Again, you wanna clean from the inner canthus to the outer. Ms. Meredith, I'm gonna go ahead and clean your face, okay? Starting with your eyes. So I'm cleaning from the inner canthus to the outer. I'm going to flip my washcloth open, clean the other eye from inner canthus to outer canthus. Flip my washcloth over. Now I'm going to clean one side of the face. Flip my washcloth over and clean the other side of the face. Now I'm going to turn my washcloth around because I have not used the closed corners. So with my closed corners, I'm going to clean one bridge of the nose, and I'm going to turn the washcloth around to the clean area and clean the other bridge of the nose. Okay? I'm going to hang this washcloth on my basin. I'm going to get the towel and I'm going to pat dry Miss Meredith's face. Remember, you have to use a towel to dry. Now this same towel I'm going to use to place as a barrier. So I'm going to expose the arm that I'm going to clean. Miss Meredith, I'm just going to place this towel underneath your arm so the sheets won't get wet, okay?
Okay.
I'm going to take my second washcloth, and let me back up just a second. When you wash the face, remember, do not put soap on the washcloth. You're only going to wash the face with water, okay? So now I'm going to take my second washcloth. I'm going to wet it. I'm going to apply soap. Make sure the soap gets all over the washcloth. This time I'm not going to fold the washcloth in 4s because I'm cleaning the arm, okay? So what I'm going to do is, Miss Meredith, I'm just going to clean your arm now, okay? So I'm cleaning the resident's arm and her hand. Okay? And now I'm going to clean underneath her arm or her armpit. And you have to clean underneath her arm. If you do not, you will not receive credit for that step. Okay, Miss Meredith, I'm just going to place your arm back on the towel. I'm going to go ahead and place this washcloth over my basin. I'm going to get my third washcloth, wet it, and now I'm going to rinse the soap off of the arm. Miss Meredith, I'm just going to rinse the soap off of your arm now, okay? I'm rinsing her hand, and I'm rinsing underneath her arm. Okay? I'm going to place this washcloth over my basin, and now I'm going to dry her hands and her arm. Miss Meredith, I'm going to dry underneath your arm. Okay? You feel okay?
Yes, ma'am.
All right. Okay, I'm just going to take this towel now. Okay. Okay, Miss Meredith, we're going to go ahead and put your gown on now, okay? The easiest way to do this, or to place the gown on the resident without overexposing the resident, is to actually place the gown over the sheets. Okay, Miss Meredith, can you go ahead and take your arm out for me? And then you'll place one arm in the sleeve Miss Meredith, go ahead and take this arm out for me. And place the other arm in the sleeve. Okay, can you lift up for me? And I'm just gonna tie the back. Now that I have the gown on, all I have to do is pull down the sheet and no overexposure. Okay, I'm gonna get you covered all back up. Okay, here's your call light. As you see, I'm giving the resident the call light. I'm making sure that the resident has their call light in their hands. I'm gonna do a quick safety check. Your bed is still in a low safe position. Bed wheels are locked and you have your call light right here. I'm gonna go ahead and dispose of my supplies and I'll be right back, okay? So now I'm going to go ahead and take my soiled linen, place it in the soiled linen carton. I'm going to take my soap, place it in the designated dirty area. I'm going to take my basin with water. Okay, so I have my basin with water. I'm going to empty the basin into the sink. I'm going to rinse the basin. And then I'm going to dry the basin. And once I do that, I'm going to go ahead and place the basin in the designated dirty area. So I'm placing the basin in the designated dirty area. I'm going to go ahead and remove my gloves without contaminating myself. I'm going to verbalize I'm washing my hands. And now I can get back to Miss Meredith and make sure she's in a comfortable position. Miss Meredith, you're doing okay?
Yes,
Okay. Would you like for me to open up your privacy curtain?
no.
Okay. Okay, we'll go ahead and leave it closed. You have your call light there. Bed is still in a low safe position. Brakes are still engaged. Washing my hands. Skill complete.